Administration has placed some Atlanta-based workers here at the CDC on administrative leave.
The move targets workers involved in diversity, equity, and inclusion programs. 11 Alive's Doug Richards is live from the CDC. So, Doug, what are you hearing from them tonight?
Well, from workers, mostly silence, because understandably they probably don't want to get any more sideways with the Trump administration than perhaps they already are. When Donald Trump visited the CDC in March of 2020, the health agency was just starting to handle what would quickly become a crippling worldwide pandemic.
We have 240 cases. Most of those people are going to be fine. A vast majority are going to be fine.
It was part of a sometimes combative relationship between healthcare workers and politicians led by the then and once again president. Now, Trump has tamped down health communications from government agencies, including the CDC, pending approval from the new administration. And Trump has singled out government health agencies, including the CDC, to suspend workers who are on the payroll specifically to advance diversity, equity, and inclusion.
The employees are killing our inboxes, our phones are off the hook.
Yolanda Jacobs represents union employees at the CDC. They include workers whose email accounts were suspended Wednesday and told they would be on paid leave for an indefinite period.
It's so much fear, so much trepidation. And for some people, it's not even a fear, it's a reality, especially, those who are being placed on paid administrative leave at this point.
Jacobs says the sudden suspensions of CDC workers came unexpectedly. But targeting workers committed to diversity, equity, and inclusion hiring is consistent with political messaging from Trump's successful campaign for president. What's unclear now is whether those suspended healthcare workers will lose their jobs entirely.
So, Doug, if President Trump eliminates diversity, equity, and inclusion workers, how might that change what the CDC actually looks like?
Well, there is data online indicating that federal health agencies have actually done a pretty good job of diversifying their workforces. Jacobs, the union president, says that something that's often overlooked is that they've really recruited hiring people with disabilities, and she's afraid that some of that may go away if this goes in the direction where it appears to be going.
All right, Doug, thank you. We appreciate that update.